Thank you so much for this opportunity so that I can share my work and my experience, my journey of the very wonderful opportunity I was given for the fellowship and being part of this network. I'm Aqsa Hashmi, working at the Drug Regulatory Authority of Pakistan, and it's a crucial organization when it comes to regulation of medicines, antimicrobial specifically. So, being part of that, I was given the opportunity to be part of the One Health Antimicrobial Consumption Surveillance Fellowship, um, being the in joint collaboration with the Fleming Fund Country Grant because I was working with them already. So they thought that it should be given an opportunity that DRAP should also have a fellowship. So that's why I was selected among my cohort from Pakistan in the professional group. Basically, the objectives are all important and very well known. And because of the policy making and practice point of view, having the data and evidences and how to utilize it, it is important that any institution or any person who is working on all the key positions and critical, holding the critical offices should at least know that what is the One Health objective and the agenda and any health related improvements that they can do on their part. And being drug regulators, I think it is very important and key that we get to know the real world evidence and get to utilize it for amending and regulating our policies and making these for the best of our own country. I would not go into details about the objectives. Basically, it was very well drafted and very well disseminated through this fellowship. I acquired a lot of learning from my mentors, from the university, from my colleagues, even those who were from other countries, and even through the multiple sessions that were, that were disseminated through the Fleming network. And through this, I was also made part of I also joined the community of practice, and we're in the regional countries from Asia. She used to share their experiences, their problems, and their working, which also helped me to learn a lot besides my routine work and professional working. So basically, in antimicrobial consumption, my role was to report the data, to collect it, and develop any policies or proposals for the authority to improve the antimicrobial consumption related or resistance related matters, and how we can, as DRAP, collaborate in that, and then develop any kind of guidances based on it for healthcare professionals, for our own regulators, or other stakeholders, which can be patients as well. All these proposals were relevantly considered by the authority, and a few improvements were also made. But still, there's a long way to go because of the paucity or the gaps in evidences that we are still trying to strengthen on our end. It is important to note that because of the WHO Sustainable Development Goals and also the UN goals, we have to have access to medicines or to healthcare. But aware list, it needs to be implemented with access limiting to 60 to 70% use, and the others even lesser than that. Besides this, I'm also taking part in capacity building of stakeholders and coordination with all the key stakeholders, which were part of the cohort selected in the fellowship network. My work plan and deliverables included the collaborative project, which helped me to, work very deeply on the database here at DRAP to note that which irrational combinations, antimicrobial combinations were being used in veterinary health sector. I will go through it in detail in the next slides. This was just a gist of the fellowship journey regarding trainings and observership and conferences. These are some of the memories that I tried to make this presentation even more colorful. I had very wonderful experiences with all the people that were there, and it helped me a lot to grow professionally and personally as well. These were some of the group activities that we did there at the University of Melbourne. These are still very memorable, and these bring a smile to my face whenever I go through these. Okay, so the data that I was working on, because the fellowship started in 2024 and possibly ended in 2026, but due to the two data sets in the annual years from 2024 and 2025, you will be able to see the extent of data that I collected or the work that had improved during these 2 years. In the year 2022, we were not able to report any specific data set because it was based on the import records, and the data only included finished drugs, which is very less amount. It is almost like 2% of the consumption pattern of Pakistan. It comprises of just that much. Whereas if you check that this data set for 2023, it comprises of data from provincial health sectors or the government health sector that they procure. And this data possibly comprises around like 30% or even a bit less than that, like 25 to 30%. And then the data set that was collected in 2024, which I worked on during the 2 years, it was from the disbursement data. I had tried to collect it from the pharmaceutical industry, and that data comprised of more than 70% of the data for antimicrobial consumption in Pakistan. So this graphical representation shows the data pattern for, the data pattern for the year 2024, the DIDs that were almost 18.61 comparative to the data and the lack of it. And the graphical representation also shows the gap that between the 2 years of the data that was collected. This is on the basis of aware classification. The pattern still remains the same, that watch class is used in excess to the excess group, but we have to still control it and keep it minimum to like 30 to 40% or even less. I will skip these. Coming to my collaborative project, I'm still working on it, even though my fellowship has ended, the journey has ended, but I'm working on it with my mentors at the University of Melbourne, specifically from the APCA, with Dr. Mauricio and Dr. Glenn and Dr. Anna. And what I have been doing is that because on the basis of the WHO medically important antimicrobials list, I had identified that if these antimicrobials which were authorized for human were present in the registered for the veterinary health sector, and I did not find any. But most of the drugs were from these, the group for authorized for both human and animals, and for animals only. And among these, I identified which of these combinations, if these were registered in combinations, whether these were irrational or rational. This was just because of the limited time. I had selected only on the basis of risk categorization a few antimicrobial combinations, and from that group only, I had identified that there were 39 combinations or 581 products from the 15,000. But still, because I have extended my work, I have done a thorough check, so this number has increased a bit more. I have identified a bit more combinations, and that I will be presenting through a paper that I will publish. So this is just a overview of which antimicrobial combinations were there. It is a concern that is shown in the Southeast Asian or the South Asian region, that some of the antimicrobial combinations that are registered here are like a cocktail of antimicrobials, and the situation is surprising, but it is also something which shows the improvements that we can make on the basis of international health regulations, on the basis of international best practices, and have these deregulated. We can also see that most of these, this is the number of brands, the number shown here. These are not many, so these can be taken out of the market or deregistered very easily and very quickly. So on the basis of this, because of the stewardship principles, the literature that is present, and the pharmacological point of view, these will be proposed to the authority by myself and by the collaborative project officers, so that regulatory actions can be taken in a satisfactory manner. So my personal journey includes that these are the accomplishments that I gathered in the form of knowledge, networking, collaboration, and participation in international conferences, because the pharma conference that I attended was the first one, was the very first one that I had, because most of the time I'm attending the national conferences that are conducted here in Pakistan. The lessons that I have learned are very key for myself, because I have to prioritize multiple tasks. I work at the regulatory authority, so everything here is on very urgent basis. We have to take actions. We have to process each and everything on very limited time. So how can I prioritize all of that and still maintaining motivation, because it is very important when working under pressure that you need to keep yourself motivated to work and not lose your interest in whatever you're working on, then conveying the information at the right time. It is also a very important lesson for me because speaking at the right time and conveying information at the right time, if we miss that kind of a window, the effectiveness of it, we lose it ultimately. And then molding works and tasks effectively, you can modify yourself or your working to the conditions that are more comfortable, that are more ample for you. And the challenges that I faced was that I did not know the veterinary point of view, the health perspective. I mostly, because of my professional educational background, I work automatically on keeping in view the human health sector and the human health viewpoint, prioritizing that. But while working on my collaborative project, I had to, make a broader perspective, including the veterinary health importance as well in this, in antimicrobial consumption surveillance because of being One Health regulators. And then working with new people, obviously, it's not easy to modify yourself, to make yourself flexible to others, but it is important that we work in a team, we work in a group, we work effectively. And it is very important for me because I work at the regulatory authority and I have to coordinate with the stakeholders from the Ministry of National Food Security and from the National Veterinary Lab, the NIH. So working with those kind of people through the collaborative project, which was part of this fellowship, has helped me to build the network that will help us in regulatory work and collaboratively with them. And opportunities for future is that I will be working on other gaps with the Ministry of National Food Security regarding the growth promoters as well. This was part of the requirement that what are my post-fellowship's aspirations. So because it is a very important step that I had worked on and I have not highlighted in this presentation is that from 2024, we started collaborating with the Fleming Fund Country Grant here to build a track and trace surveillance system for antimicrobials. It is a one-of-a-kind integrated system here, which will monitor the supply chain of medicines, to identify inequality matters, to identify the consumption patterns of antimicrobials, and to locate where most of the antimicrobials have been consumed or how much have been consumed or which class it belongs to. And it will integrate the import data, the manufacturing data, the distribution data, which we had in the future plan to scale it to the pharmacy level. But unfortunately, because of the closure of the the Fleming Fund grants, so the scalability could not be done, but we are still working on our implementation to the distribution level. We have recently implemented the 2D barcoding, which will automatically align any person to track that the medicine that is available in the supply chain reported to the track and trace system is a genuine medicine and not something which is substandard or falsified. That will be the national One Health antimicrobial consumption surveillance system. And through this, we will collect the annual data on AMC, report it to the WHO and to the WOHA platforms as well, because I can see that some of the requirements for animal data are not catered from the import data that we currently have. So the species-specific information that we need. And then we also are in the process of nominating and selecting the technical working group for national antimicrobial consumption and use surveillance, that they will evaluate the consumption patterns and propose any kind of policies or regulatory measures that need to be taken. So some of my recommendations, these were towards my own regulatory authority. These were for drafting the driving force, opportunities at the building force for improving quality of care, systems and opportunities due to data gaps, and then transforming challenges into opportunities. These were some of the my recommendations to my own authority, to my own colleagues, so that our own working and our own systems can be improved. Thank you.
Thank you, Aqsa. Well done. Yeah, I think it's always nice to see those slides with the photos and the opportunities that you get with these fellowship projects. So Yeah, no, well done. Thank you. Abiodun, do you want to get your slides ready to share now? And while you do so, I'll just quickly introduce Abiodun, who's a medical doctor, field epidemiologist, and researcher with expertise in AMR, data science, bioinformatics, and the public health policy. Currently, Dr. Egwuenu is a PhD candidate at the Berlin University of Medicine, where she is analysing and modelling the spatiotemporal dynamics of AMR using surveillance data collected over 10 years in Nigeria. Her work aims to generate data-driven insights to strengthen public health interventions and inform policy responses. She also serves as Vice Chair of the Board of Members of Applied Epi, supporting the organisation's mission to advance applied epidemiology using R. So, hopefully, Abiodun, are you okay to start sharing your slides?
Yes, thank you very much, Michael, for that presentation. I'll just, thank you very much. Yeah. So I am Abiodun Egwuenu, as said, and I am part of the AMR Surveillance Human Health Fellowship, Cohort 1 in Nigeria. Just to say that before the fellowship, this was the situation in Nigeria. We had just finished conducting our situation analysis in 2017 and developed the first SNAP. And what we saw was that we had some of the priority pathogens that had been listed in the WHO GLASS documents in high prevalence sometimes from research data, and even multi-drug or SKP organisms had been recovered. But as at that time, we did not have a dedicated AMR surveillance system, which was initiated in 2018. It was also a One Health issues. And in humans, neonates and children were more impacted. And the laboratory capacity to report data was a challenge, and we had just developed our first national action plan. So the Fleming Fund Fellowship across also other countries had started in Nigeria, and I was with the Denmark Technical University team. The plan or the approach was to contribute to the global dialogue on AMR, and then support the DTU supported us as professional fellows to build our technical and leadership skills through mentorship, secondment, specialized training and participation, and implementation of collaborative projects. So my mentor was Pernille Nielsen, and you will understand better why I was called a late arrival. So in 2019, the Nigerian government received support from the Fleming Fund to train 10 fellows. I was the AMR program coordinator at that time, the Human Health Focal Point, and the fellowship was hosted by two host institutions, the UKHSA, then Public Health England, and the Denmark Technical University. And this is the media launch in 2020. But I was unable to join the group until, although it started in 2019, I was not unable to join the group until early 2020, and I was almost also 9 months pregnant as at then. And the objectives of the fellowship was to strengthen capacity in AMR surveillance, make better use of the evidence, that we sustain the AMR surveillance system, we strengthen the flow and collection of data, ensure that there's competency in data analysis, and also support AMR information sharing across One Health domains. So as I mentioned, in 2020, I joined the team, and we had some trainings, and it was actually in the middle of the COVID-19 pandemic. I remember when I started the fellowship, it was March 2020, and I had just delivered February 2020. So it was quite a lot, but I received a lot of support from the DTU mentor. I also participated in a lot of virtual trainings. This was also in the middle of lockdown, travel restrictions, but I was able to get trainings on use of AST lab methods, questionnaire design, sampling, risk analysis, VNet, and R. I also worked with my mentor to develop my proposal and then to implement my project and graduate in 2022. So I started the fellowship, and my focus was looking at the pattern of extended spectrum beta-lactamase producing E. coli and Klebsiella pneumoniae in hospitals and communities in Abuja. I was able to collect data from 422 respondents 131 blood cultures, 311 stool cultures, and 24 environmental samples. This is me in the lab, and also when we were collecting data. That's one of my research assistants standing beside me. And the data, we were able to collect data. So the median age of those that we collected data from was 12 years, male to female ratio 1:1. And majority of them had had an illness for which an antibiotic was taken in the last 3 months. 33% of those had taken a drug. And in the hospital, the commonly provided drugs were cefuroxime, in the community, nitroimidazole, that is particularly metronidazole, that is in 16.3%, and 78% of those in the community had purchased the medicine over the counter. Then when we looked at the ESBL producing isolate, 18.9% were ESBL producing and 10% were actually multi-drug resistant. And then looking at the pattern, comparing Klebsiella pneumoniae and E. coli, majority of them were resistant to piperacillin, ampicillin, cefaxolin in that order. And then there was also some resistance to tobramycin and gentamicin, which is expected. Some of the skills I gained during the fellowship, one that I would particularly highlight was using the R package for data analysis. I also co-authored several papers. I had opportunities of presenting at several webinars. For example, I presented on the practice of clinicians regarding sepsis diagnosis, antibiotic use, and blood culture diagnostics, looking at the data in 2021. I was also a panelist during one of the National Antimicrobial Awareness Week, where I had the opportunity of sharing some of the skills and experiences from the fellowship. And one of the moderators was also, the moderator at that meeting was also one of the fellows in Nigeria at the time. So also during the process, I was able to develop a standardized WhoNet data collection template for AMR surveillance data in Nigeria. The number of hospitals reporting data grew from 3 to 15. I also collaborated with other fellows to train the AMR surveillance site on the use of WhoNet. On the right is Dr. John Sterling, the creator of WhoNet. He came to Nigeria as part of our support that we also requested, and he trained the sites on actually using the WhoNet, how they can use it for data interpretation, and also use it to improve stewardship activities and also detect outbreaks in Nigeria. Before then, we had started drafting the National AMR Surveillance Guideline, which I was leading, and during my fellowship, I was also able to publish that. As the AMR focal point for human health in Nigeria, then I was able to consistently submit data to GLASS because I was also able to use these tools now more consistently. And I presented this data at the AMR Technical Working Group meetings, where it was now shared also with the Director General of the institution and also to the ministers. Even though I was unable to go to the Denmark Technical University throughout the fellowship because of lockdown and restrictions were raised in Denmark only after the fellowship had ended, I went to the University of Ibadan, Professor Ruka Okeke's laboratory, where I learned more about bioinformatics. And then just bringing it home after the fellowship, one key thing that really helped was that the fellowship and art training were actually key to my growth and part of the catalyst for my PhD. One of the mentors during the fellowship, Dr. Patrick Njagi, actually was the first person that introduced me to R. And afterwards, even after the fellowship, he actually created a group for Africans who were interested in learning R. And I participated in this training, and this really improved my data analysis skills and understanding of how to manipulate AMR data. And since then, I have started my PhD at the Charité, analyzing Nigeria AMR surveillance data across a decade. If you recall, I shared an image where I actually presented, and at that meeting, just as the fellowship started, we had also started a partnership, that is the NCDC, with the Robert Koch Institute, and Dr. Sarah Tomczyk was part of that, and Sarah has became my mentor during this process, and also supported my PhD application at the Charité. And now I'm working on analyzing the data. Last month I came to Nigeria, where I presented some of the preliminary findings, and we were able to come up with a more sustainable approach with the current focal point for AMR surveillance in human health in Nigeria. So this is me presenting some participatory way to improving hub and spoke approach for AMR-AMU response in Nigeria. So my aim now is to complete my fellowship, publish my data. I'm also still finalizing some of the publications from my fellowship, so I'm also hoping that this year I'll publish that. I'm also part of the Fleming Fund Steering Committee member, so I hope to also give back to other fellows and alumni in any way that I can. And my love for R has since grown, and I'm currently a vice president on the Applied Epi Board of Directors, where we are looking at how to expand training on R, also looking at how to support both those working in the space of AMR and other infectious diseases on how to use R to improve data interpretation use, and also for policy making, both in Nigeria, Africa, and globally. So I'd like to thank everyone who has been part of the journey, the former DG, the AMR Secretariat team who really supported during my fellowship, all AMR surveillance sites, the Fleming Fund, the Denmark Technical University, particularly Pernille Nielsen, who really supported throughout my fellowship, Robert Koch Institute, as I mentioned, Sarah, who has also been supportive of my journey, my family, my husband, Caleb, and my kids, and all who have supported this journey. Thank you so much for your contributions.
Brilliant. Thank you so much, Abiodun, and as well, thanks to Aqsa again for your presentations. A lot of interesting work, and the successes from the Fleming Fund Fellowship is always lovely to hear, which I'm sure most on the call can relate to as well. So we are now going to open the floor up for any questions for Aqsa or Abiodun. You can feel free to put your hand up and you can ask a question that way, or we have got the Q&A section or the chat section if you prefer to ask a question in either of those ways. I think while I give everyone a few more minutes to think of some questions for Aqsa and Abiodun, I might start, and I am going to start with Abiodun, just coming off that presentation. At the start, when you were talking about the AMR situation in Nigeria before you started the fellowship to obviously the position that you're in now, how do you find the communication aspect of that, being able to communicate the AMR situation in Nigeria, but across different target audiences, obviously different regions? Now you're studying in Berlin. How do you find that?
Yeah, thank you. I think for Nigeria, when we started in 2017, the information was more in like academic. A lot of people in the universities knew more. Majority of the persons in the community were not aware. And one of the key pillars of AMR response was actually the awareness week. And as fellows, and one of the fellows, we really prioritized that. So when we were there, through the Fleming Fund Country Grant, we actually started a national community of practice, which is still ongoing. And we as fellows use that opportunity to disseminate our findings, our studies, also in simpler languages. One of the things that we also did as fellows then is during one of the awareness weeks, we actually went to the community and conducted like a key informant interview. And what we found out was that, and also focus group discussions, people did not understand the concept, at least those that were older, and those that understood the concept, they felt the human beings were resistant to the organisms. And also antibiotics were seen as curative. They could cure all conditions because when people use it, they get better. So they did not understand how to use it. So we as fellows also came up, some of us were already working as focal points in Nigeria. So we all came up with messaging to target that. So I think what I learned was to kind of simplify my message based on the audience, sometimes making those information less technical and more understandable, digestible for the communities, which is kind of different in Germany, I think, because also their surveillance system has been there for a while, and also maybe, at least I'm in Berlin, I don't know how it is in other parts, but also here there are a lot of people that are maybe educated, or which we noticed in Nigeria, to higher the literacy level, the better the understanding, and the higher the chances that they've come up across this concept of AMR.
Brilliant. Thanks, Abiodun. Yeah, and obviously it's not too far away now, is it, till the awareness week again in November. So again, another chance for everyone to spread the word on AMR. I think if no one else has got a question yet, I then have another one for Aqsa. I did just want to ask, kind of from your fellowship journey to now being a deputy director, what roles and behaviours from the Fleming Fund Fellowships do you think helped and still help you in today's role that you're in?
Well, because of my personal journey, specifically working with other people and seeing how they, take things forward regarding networking, collaboration. Because still in antimicrobial consumption and antimicrobial resistance surveillance, we have not come so far as many other countries. We have recently revised our national action plan. We have been collaborating very well, very effectively. But still we have to do a lot. And in terms of fellowship and in terms of this specific program that was provided to us, I think what I have changed in my working is trying to reach out, still thinking that if anything is impossible, but you can still do it. Things might seem overwhelming or they might seem difficult to achieve at the moment, but when you start taking one step at a time, that were the words of my mentor, one step at a time, then it is that you reach somewhere and you ultimately start seeing that things that come into realities, things start realizing, when I was working on the track and trace, I was very motivated because whenever I used to interact or talk to my mentor, she used to say that you're very motivated in doing most of the things, but you should take one step at a time and not try to take everything simultaneously and not be super excited with whatever's happening. Be realistic, be practical, learn to say no to things. And it has helped me in my profession as well. Because the role at whatever we are doing in regarding to antimicrobial resistance and consumption surveillance, we have to take careful measures, we have to take practical approaches, regulatory measures need to be very well thought out. Because we have to ultimately implement these decisions on the pharmaceutical industry. We have to take the lead, coordinate with our provincial governments because of the healthcare system in Pakistan, which is a bit different from most of the countries, but similar to individual states which are operating in their own autonomous healthcare systems. So collaborating with the other stakeholders and trying to realize what helps, what guidance or what help or what the strengths you can use from the other organizations and what you can contribute. That is something that I have very well realized during this fellowship, which I had probably not so much as I had thought out before I had been, I had completed this journey then.
Yeah, brilliant. Thanks, Aqsa. I believe Kerry has just put in the chat for both of you. For your own professional development and impact, do you find it most useful to collaborate nationally or cross-country and regionally? And what's the biggest piece of advice for those looking to become leaders in the AMR space? Abiodun, do you want to start first and then we can go back to Aqsa?
Thank you very much, Kerry, for the question. I think I will just say collaborate. You don't know where it might lead you because there's always, I try not to look down on any form of collaboration, any form of support. I remember even when we were during the fellowships, we threw around ideas. Somebody has developed a tool, like for example, M.Phil was one of the fellows and she developed a tool and she was a veterinarian. I looked at it, I said, oh, I need a tool. She just gave it to me. I updated and reviewed it. and updated for human health, and it really helped my work. So I think we just have to work together because AMR has no boundaries, and we can learn from each other. We can learn from even the communities that we are dealing with. So I would say just collaborate. And I think for becoming a leader, I think is to seek to help people or to help or to contribute your part. My coming into AMR was not something that I orchestrated, as at the time I started the response, I had just completed field epidemiology training program in Nigeria. That was in 2016, and in 2017, the first day I went to the Nigerian CDC, I had just been posted March, and I was given a letter. The second day I arrived, and I was ushered into a room, and I was told, oh, we are developing a situation analysis for AMR in Nigeria. I want to develop a national action plan. This was in, I think, March, and we were supposed to deliver it to the minister in May. So I was now put at the center, and I was told, you have to support the team. You're an epidemiologist now, you've done this training. I was like, okay, yes, I know about AMR, but not in that sense. So I had to study, I had to learn, I had to collaborate, I had to discuss across sectors. We had to collaborate with the Ministry of Agriculture, Ministry of Environment. So I think to become a leader is to serve, it's to give your all. And I remember those times when AMR started, it was not like I knew that the fellowship in Fleming Fund was coming in 2017, but I think in providing that support, people now, you become an expert unknowingly, you start learning more. And as you continue to give more, you continue to learn more, and then people see you as someone that can lead, because I think leadership is based on those that are following. They really want looking up to you. You are not a leader without having people that maybe support you, or vision, or support what you are saying. So I think to lead is to serve in the space of AMR.
Yeah, brilliant. Abiodun, Aqsa, do you want to respond to Kevi's question in the chat?
Yes. For finding it if it is useful to collaborate nationally or on the provincial or regional level, it is important to study and have the background knowledge of how your health system, care system works. Is it integrated that if you provide any kind of information at the national level, do you find it that it reaches the persons who are working in the field, who are actually a part of the practice of the use, or the the very last person who are interacting with the patients? If you can see that it is successful, then yeah, you do not have to work very hard to go to the regional levels to interact with them. But if your system is in that sort of way that you need to interact with the regions, you need to interact with the provinces, with the healthcare professionals yourselves. So then in that case, you have to make it your priority to involve those levels as well. But it is also important to take the regions, the provinces, the governments who are working at the regional levels, the provincial levels, to be part of any policies or any working or any responsibility sharing activities, so that they equally feel that it is something that they can pitch in as well, they can collaborate in as well. And being part of the regulatory authority, it is also important that we learn to be the leaders, the managers, because identifying how you can get things done is very important for our role that we perform in each and every designation here. And it teaches us that we have to observe the stakeholders that we are working with, to know their strengths, to know their weaknesses, and to know the opportunities that we can utilize those strengths, and not their weaknesses, but combine these strengths and to make good policies, and to try to cover or fill in the gaps that are in our working, that are in the healthcare system. We have since starting working in 2012, you will be, if you start looking up our organization, if you start looking at our journey as the Regulatory Authority of Pakistan, you will be able to see how far we have come due to this kind of approach that we are practicing in Pakistan, by working with the provincial governments, by working with the stakeholders, and not working at the national level only. We work with the jointly with the provincial governments. We take their suggestions, take their recommendations, and we share that kind of responsibility. We share all that the health priorities that need to be addressed at any level.
Brilliant again. Yeah, thank you so much, Aqsa and Abiodun, for those responses to Kerry's question. With 1 minute left, does anyone have any last minute questions or comments? I'll give it a few seconds. If not, I can start to close. So yeah, so it looks like there's no more questions for today. So thanks again, Aqsa and Abiodun, for presenting this morning. As usual, the recordings will go live on the Fleming Initiative webpage and the YouTube channel, and we'll share them to you once they're ready. For next month in September, we do have Rod Card, senior scientist from the Animal Plant and Health Agency in the UK, talking about how APHA are tackling AMR, but also we'll have Julia Somby, a Sierra Leonean fellow and one of Rod's group of mentors, on operationalising AMR in a low resource setting, something similar to what you presented at the One Health AMR conference in Bangkok this year. So please keep an eye out for that invitation to come through. I think I'll now close the seminar. Thanks to everyone who joined this morning. Have a lovely day, lovely evening,